So for the last week and a half, maybe 2 weeks at this point, Amberlynn Reid has been talking about her recent cellulitis infection, which is certainly not her first and certainly will not be her last. And based on my own extensive personal experience with recurring cellulitis infections, about every month to month and a half for 3.5 years, from age almost 21 until age 24, I've found that there is a piece of information missing that I think is important to bring into the conversation, since it's of course something that Amber is going to omit. Of course she's going to omit it, but in my experience with having cellulitis very, very frequently, certainly 30 times, probably more than that, frankly, it was a very disturbing time in my life, and I certainly don't wish to revisit that to give you a precise number, but that sounds pretty close. I had cellulitis frequently, could not get rid of it, and for reference, at the time, my highest weight would have been about 110, 115 pounds. I am 5'6.5". Since I had it so frequently and was so ill all of the time, I didn't have much of an appetite. And sometimes antibiotics can hurt your stomach, it just depends. But weight certainly was not a factor for mine. Hygiene also did not play a role in my recurring instances. I saw multiple infectious disease specialists, wound care specialists, surgeons, a whole array of doctors over the period of time where I contracted it routinely. And I was prescribed a routine of taking bleach baths 3 times a week, on top of bathing every day with Hibiclens, which is a surgical antiseptic, like something that a surgeon would use to scrub up before doing open heart surgery, for example. That is something that I still do to this day. The bleach baths I do about twice a week. I still bathe with Hibiclens every day. And I have a rotation of topical antibiotic creams, which Bactroban or mupirocin, and then steroidal creams as well that I have to switch out every 2 weeks so they don't lose efficacy. And hygiene wasn't it for me, and it wasn't my weight. I used to start skipping class when I was enrolled at university to stay at home and bleach my apartment for hours every day, because I sure as hell wasn't going to have the onus of responsibility put on me for a lack of cleanliness. I knew that certainly wasn't the case, but yet I still kept contracting it. The cellulitis that I would get was MRSA cellulitis, which is methicillin-resistant Staphylococcus aureus. It is a staph infection that is resistant to many antibiotics, and I am allergic to amoxicillin and penicillin, which already removed 2 potential antibiotics from my treatment options straight out of the gate. And in Amber's case, her cleanliness certainly is a massive factor. There's no arguing otherwise. This certainly isn't an opinion. Just logistically speaking, she simply cannot properly clean herself due to her size. And that isn't a value judgment. That isn't trying to be making a dig at her. That is just simply the fact of the matter. So if she can't properly bathe herself and her folds and the like, that's going to invite infection, as you'll have a lot of bacterial growth, perhaps fungal growth as well. Delicious. So that certainly plays a role for her. In this case, the thing that's missing from the conversation that really needs to be emphasized, the reason that I could not get rid of my cellulitis infections was from chronic, long-term, prolonged, perpetual high blood sugar from undiagnosed type 1 diabetes. I was diagnosed 2 years ago at age right before I turned 31. it is a miracle I'm alive. I am flabbergasted, to put it mildly. And I'm very lucky to be here. And in being here, I do feel it's important to note that having high blood sugar completely obliterates your immune system. It invites infection. That is just simply the fact of the matter. In Amber's case, she will not treat or even admit to her chronic high blood sugar from her untreated type 2 diabetes. So with high blood sugar on top of her lack of ability to be hygienic, this invites infection. I mean, she is simply ripe for it. And the infections are going to persist if she can't improve her hygiene and if her blood sugar isn't under control, because her immune system is just completely devastated. That's what high blood sugar does to you. And whenever you do have an infection or whenever you're ill, that in and of itself will also spike your blood sugar drastically. So for instance, with my treated type 1 now, if my blood sugar keeps elevating and my insulin pump is taking note of that and trying to compensate, that's usually a pretty good indication that I may be getting sick. I haven't had cellulitis since I was 24. I had 2 MRSA infections since then, and given what I had experienced prior, I would consider that one of the greatest wins I could possibly imagine. Now, you do have to have a break in the skin, some kind of wound or cut, to invite that bacterial infection in for the cellulitis to be able to disseminate and fester. And sometimes you don't necessarily need that either. In my case, personally speaking, there were multiple instances where there was no wound present, and yet there would be a very deep tissue infection full of MRSA pus. It's so disgusting. Sorry to put that into your brain there if you're listening to this. I found that I had repeated instances of cellulitis where there wasn't a break in the skin, but most of the time there was. And the reason for this is because of dry skin, and prolonged high blood sugar creates dry skin, among other issues, but that is just one of them. So in Amber's case, she has no immune system because her blood sugar is always high. She won't treat her diabetes, and her dry skin is going to be a consequence of that as well, which is going to also create opportunities for cellulitis to occur. Unfortunately, this isn't something that I want to have in common with Amber. I don't want to have anything in common with Amber, personally speaking. But she and I have had many similar experiences simply due to a decade or more of high blood sugar from diabetes. The difference is that I have type 1 and she has type 2. I did find it amusing. I mean, the audacity. I found the audacity amusing for her to have recently said, in the last couple of days, she made some remark about how she doesn't even have pre-diabetes. And it's like, yeah, girl, like, yeah, you don't have pre-diabetes. We're past the pre. You've got the whole damn thing. That's what you have. But I found the way she phrased that to be coy in an embarrassing way. But something that I really deeply take umbrage with is her refusal to acknowledge that she does have type 2. And having type 1, I was so sick for 11 years that I got to a point where I was sleeping for 20 hours a day because I was so sick and exhausted. I couldn't lift a 12-pack of soda. I got to a point where I couldn't work or stay in school because I was so sick, and it took me a very long time to figure it out. And there are a lot of reasons for that I will not include here. but it was maddening. You know, and I'm very lucky to be alive. And since I know what's wrong with me, I have done my damnedest to fix it and to do my best to manage my type 1. And knowing what's wrong with me now, I have certainly taken that by the reins. My A1C was so bad, like, Foodie Beauty doesn't have shit on me. Like, that's not a brag. That's not a brag, to be clear. But just to give you a frame of reference. Since I started insulin, like 2 years ago, I gained 40 pounds in a year. This is me after gaining 40 pounds. And I'm cellulitis free because my blood sugar is, I'm nailing it. It's great. But Amber's never going to see a reduction in her cellulitis infections if she doesn't manage her blood sugar to help her immune system, and if she doesn't lose weight to be able to properly bathe herself and pursue proper hygiene, among other things. And I certainly think it's important for people to know that that's something she's omitting, and it's not something that I have heard others discuss about how her flagrantly untreated type 2 diabetes and high blood sugar is a massive contributing factor. I mean, it's inarguable. And she's never going to get rid of it if she doesn't finish her courses of antibiotics all the way through. And I wouldn't be surprised if she just doesn't complete her course of antibiotics when she has it, which is horribly dangerous. You have to rotate the antibiotics, you have to rotate different courses of them so that way they are still able to eliminate the infection when it occurs again. And part of doing the proper rotation is making sure you take the whole damn course of antibiotics. For somebody like Amber, with her size especially, cellulitis would be life-threatening, and I imagine, I would imagine that IV antibiotics would probably be very critical for somebody of her size. But this might shock you, but I'm not a doctor or a nurse, and I don't have a medical degree, so I'm not the person to ask. Of course, I take some of this too personally with my experiences with my untreated diabetes, the cellulitis, and how that completely obliterated my will to live. It's not like I was really doing well at living, to be clear. Mostly it was just trying to survive from one infection to the other. And it was maddening, to be sure. But I have done everything that I can do to help myself and make sure that I can rectify the issue, because I didn't want it to persist. And I don't think that Amber shares that. I simply don't. I am astonished that she wouldn't be on IV antibiotics for cellulitis, especially at her size, but maybe she is sometimes. I know I certainly had multiple times where I had IV antibiotics for my cellulitis infections. For instance, one of them was above my left eye in the eyebrow, and it swelled my entire eye shut, which, gnarly, great time. And could have lost my eye, but did not. And of course followed all of the instructions from the wound care specialists, infectious disease specialists, and then of course another MRSA cellulitis infection was right on the horizon, as it always was. But there are some very glaringly obvious things that she could do to prevent, or at least mitigate, the extent and frequency of her infections, and treating her diabetes is an integral part of that. But of course she's not going to mention that part. And I do certainly take umbrage with her having this public platform, regardless of whether people hold her in high esteem, which I know that people don't. But for anyone who stumbles upon her out of the blue, to think that someone can exist at her size and for diabetes to not be in the equation, I find that reprehensible, despicable, for her to even insinuate that, oh no, I don't have diabetes. Like, she certainly does. And she's never going to admit it unless it ends up being somehow something she can monetize, or an arc for her to get viewership or viewer retention somehow. And even then, I don't know. I guess we'll have to see. But you can't exist like, and see, this is something that she could manage through diet and exercise, and she knows what's wrong with her. And I find that so disturbing and infuriating. It just deeply horrendous, because I had to fight and claw to stay alive to get my diagnosis, and it should never have taken as long as it did, but it did. And I was desperate to know what was wrong with me, and once I figured it out, my life changed completely, immediately, because I wanted it to. I want to do better for myself, and she does not possess that same desire, and she couldn't make that clearer. And I know it is absolutely absurd and futile for me to be frustrated by that. Well, I mean, but it is deeply frustrating. So while everyone has commented about her cellulitis and she's made her own remarks about it, certainly please keep in mind that another component of it, and a critical component of it, is that she has no immune system to effectively help fight against potential cellulitis infections because of her high blood sugar that she refuses to acknowledge or do anything about. So, just wanted to introduce that into your consciousness, since she certainly will not. Being diabetic sucks, it does. Being able to manage it through diet and exercise, certainly it would be a big task. It's not easy to avoid sugar with how it's baked into almost everything in the American diet. It's difficult to avoid, but she can try. But she won't, because she doesn't want to, and it's easier for her not to. And that is always going to be the case. She will always take the path of least resistance, regardless of what that consequence is. And for any potential diabetics out there, if you run into issues of recurring infections, make sure you keep an eye on your blood sugar. And the lower your blood sugar is, the better range that it's in for a longer period of time, the better your immune system will be, and hopefully you don't run into the same issues that I ran into or that Amber runs into. So, have a marvelous day. Thank you for listening to me rant. It's fine, I have a therapist. It's fine. Sorry that you had to stumble upon this. All right.